गुड मॉर्निंग टू ऑल। आज हम डिस्कस करेंगे लॉन्ग एक्टिंग रिवर्सिबल कॉन्ट्रासेप्शंस के बारे में। डेफिनेशन: LARC is defined as contraceptive methods that require administration less than once per cycle or month. These methods are also called forgettable methods. जो ये LARC है ऐसे कॉन्ट्रासेप्टिव मेथड्स है जिसको 2 महीना में या 3 महीना में या 1 साल में या 5 साल में यूज करने की ज़रूरत पड़ती है। एक बार इसको लगा के उसके बाद आप इसको कुछ टाइम के लिए भूल जाइए। अब इस मेथड्स का एडवांटेज क्या है, इनके क्या फ़ायदे हैं? एक तो सबसे पहले मोस्ट इफेक्टिव है, हाई रेट ऑफ सेटिस्फैक्शन है, डोंट रिक्वायर डेली एडहेरेंस, रिक्वायर फ्यूअर विज टू हेल्थ सर्विस फैसिलिटीज़, दीज आर चीपर्स, आर इजीली रिवर्सिबल एंड दीज आर suitable फॉर ऑल एजेस and don't affect fertility after removal. So now what are the different types of LARC? Number 1, copper intrauterine devices. Number 2, hormonal intrauterine devices. Number 3, progesterone only injections. Number 4, progesterone only subdermal implants. Now we will discuss about the copper T. Copper intrauterine devices. There are the many copper intrauterine devices available in India. कॉपर टी 380A, इसको हम पैरागार्ड भी कहते हैं। ए इज फॉर द कॉपर ऑन आर्म्स। इट रिलीजेस कॉपर एट रेट ऑफ 50 माइक्रोग्राम पर डे। इट इज रेडियो ओपेक, सो ऑन एक्सरे एंड अल्ट्रासाउंड इट इज विजिबल, सो इट हेल्प्स इन आइडेंटिफिकेशन ड्यूरिंग रिमूवल। इट इज सप्लाइड फ्री ऑफ कॉस्ट इन इंडिया एंड इट्स लाइफ स्पैन इज 10 years. Its failure rate is 0.8 to 1 per 100 women years. So what is the mechanism of action? It starts working immediately. Copper ions are released from copper wrapped over the copper T, and these copper ions are toxic to sperms. So they either decrease their motility or kill them. Copper also turns endometrial lining into a hostile environment that prevents implantation. Copper T also thickens cervical mucus, so it prevents the penetration of sperms into uterine cavity. So when to insert copper T? Before insertion of copper T, we must do pelvic examination to know the size of uterus, direction of uterus, and any infections in cervix. It can be inserted within 5 days of menstrual periods because at this time pregnancy is ruled out and cervix is also slightly open, so it is easy to insert. Just after delivery or within 48 hours of delivery, after 4 weeks of delivery, just after first and second trimester surgical abortions, as soon as you evacuate the uterus by suction and evacuation, immediately introduce copper T in same sitting. Recent termination of pregnancy by medicines. As soon as the product of conception is expelled out by medicines, you can introduce copper T. Any time ruling out the pregnancy, so there is no fixed time to insert the copper T. You can introduce copper T at any time because many women don't come back in health facilities when you call them on the particular day. So whenever these women approach you, you can insert copper T at that time, but after ruling out the pregnancy. So it starts working immediately. So what are the suitable candidates for copper T? All the patients with systematic problems like ischemic heart disease, hypertension, diabetes, epilepsy, these all candidates are suitable for the copper T because copper T does not contain any hormone. As you all know, hormones affect these diseases by affecting our metabolism. So most suitable candidates are the period women who have children, 1 or 2, breastfeeding mothers, Patients with cancer like breast cancer, liver tumors, or patients with hepatitis. It may be active hepatitis or flare-up of a old hepatitis. Venous thromboembolism, cardiovascular diseases, hypertension, diabetes, obesity, smoking, headache of any type. Any type means migrainous headache also. The patients who are taking the medicines like anticonvulsant, rifampicin, rifabutin can use copper T. Nulliparous and adolescent women can also use copper T, but it is second choice in those cases. Contraindications. What are the contraindications to copper T? Any infection of genital tract. Any infection means infection present now, not the history. If the woman has infection in past, so that is not a contraindication for the insertion of copper T. So during infections you can't insert copper T because during the insertion of copper T you can carry infection from cervix to endometrium and then to the fallopian tubes. If this infection is due to chlamydia or gonorrhea, it can block the fallopian tubes, also result in infertility. You can't introduce the copper T 48 hours after delivery. Unexplained bleeding PV. If the women have irregular cycles due to any reasons, before diagnosing that, you can't insert copper T. Distorted uterine cap. Cavity may get distorted due to fibroid or uterine anomalies. In these cases, it is difficult to fit copper T inside the uterine cavity. So there are the more chances of expulsion in stage 3 and stage 4 of AIDS. Because the patients who are in stage 3 or stage 4, they have poor immune system. So mild infections can flare up in these cases. Allergy to copper, any malignancy of genital tract. What are the side effects of copper T? Just after insertion, it can lead to crampy pain, lower abdomen, irregular bleeding per vaginal. Irregular bleeding may be intermenstrual bleeding or spotting. Dysmenorrhea, pain during periods. It can lead to heavy menstrual bleeding. Can introduce infections to upper genital tract during insertion. And last is the expulsion. Next intrauterine device is the hormonal intrauterine device. It contains 50 mg of levonorgestrel in vertical limb. It releases LNG at rate of 20 microgram per day and it declines to half by 5 years. Blood progesterone level increases up to 130 to 200 picogram per ml, which is much lower than other injectable progesterone only methods. So its side effects are less as compared to other progesterone injectable contraceptive methods. So it is more safe. It is effective for 5 years as a contraception and drug is released for additional 2 years more. It is also radiopaque and failure rate is 0.2% per 100 women years. So what is the mechanism of action? It only inhibits ovulation in 15% of cycles. So main mechanism of action is thickened and scant cervical mucus. It prevents the penetration of sperms. It causes the endometrial atrophy that is unsuitable for implantation. It also induces the intrauterine inflammatory response that also inhibits implantation. So what is the time of insertion? Just like copper T, it is induced from day 1 to day 5 of menstrual cycle and it will be effective within 7 days, not with immediate effect. This is the difference from copper T. What are the additional benefits of this device? In addition to contraception, it provides following benefits because it contains levonorgestrel. Due to levonorgestrel, there are the additional benefits to the women who use it. Number 1, reduce blood loss and pain in fibroid uterus, adenomyosis, endometriosis, because it causes endometrial atrophy. In first initial 3 to 6 months, lady may have the heavy bleeding or spotting, but after 6 months, this heavy bleeding gradually reduces, and after 1 to 2 years of its use, it can stop bleeding. So, decreased blood loss and dysmenorrhea in DUB, and it increases hemoglobin levels, as it causes a thickening of cervical mucus, so it lowers the risk of PID. In the women who are old, it can also be used as hormone replacement therapy, as this advice contains progesterone that affect many systemic diseases, but its concentration is very low in blood, so it can be safely used in the following conditions. In breastfeeding mothers can be inserted after 4 weeks of delivery. It can be used in obesity, mild hypertension adequately controlled. It can be used by the patients who smoke, or it can be used in non-migraine headache and the patients using anticonvulsant medicines, rifampicin, rifabutin, in acute hepatitis. Nulliparity and adolescent can use it, but this is not the first choice for them. There are the other better options for them. It can also be used in the patients who have cardiovascular diseases and severe hypertension as a second choice. So it is not the first choice in those cases. What are the contraindications? Any malignancy like cervical cancer, breast cancer, liver tumors, acute venous thromboembolism, and avoid in cardiovascular diseases, uncontrolled hypertension, diabetes, migraine with aura or migraine without aura, antiretroviral therapy, and stage 3 or stage 4 of HIV. Last is the genital tract infections. After insertion of copper T or Mirena, what you will advise to women? You will tell her that copper T will starting working now, but Mirena will start working within 7 days. So for 7 days you can use additional contraceptive methods like barrier contraceptive methods or other emergency contraceptive methods. Spontaneous expulsion can take place up to 3 months. So you keep vigilant to notice any expulsion of intrauterine device. No sex and tampon used for 24 hours after insertion. Warning signs are fever of 101 Fahrenheit, chills, and strong or sharp pain in abdomen. First two symptoms will tell you about the acute infection, and last one will tell you about that whether copper T is in uterus or it has penetrated uterus and went inside the abdomen. A third option is the implants. There are the many different types of implants. Previously used were Norplants. It contains 6 rods. Jadale, it contains 2 rods. Implanon, now used. It contains only 1 rod. Nexplanon. It is similar to implanon, but it is radio opaque. Capranon. It is biodegradable and effective for 1 year. Upper ones are not biodegradable. They need a removal after the expiry. But Capranon don't require removal. It degrades itself. So what is the mechanism of action? It prevents ovulation. It thins the lining of uterus and it thickens the cervical mucus. So now we will discuss in detail about implanon. Flexible single plastic rod contains etonogestrel 68 mg. It is released at rate of 67 microgram per day into the systematic circulation. It is effective for 3 years and it is the most effective method. Its failure rate is minimum, that is 0.01%. So it is even superior to the permanent sterilization methods. And return of fertility is prompt. So what are the advantages? It is a long acting. It acts for 3 years. It is safe. No need of daily attention. Can be used by breastfeeding mothers. Cost effective. But it is not supplied in government setups. Free. It is inserted in OPD. It becomes effective in 24 hours after insertion. Immediate resumption of fertility after removal. No systemic side effects. So, who are the suitable candidates? It can be used by the nulliparity and adolescent girls. It is the first choice for this category of patients. The women who have uterine fibroids, where we can't insert the copper T, adenomyosis, endometriosis, because it reduces the pain and blood loss in these diseases. It can be used in acute hepatitis. It can be used in adequately controlled hypertension, obesity, smoking, non-migraine headache, in stage 3 and stage 4 of HIV. And it can also be used in the genital tract infections, where we can't use the copper T and hormone intrauterine devices because they introduce the infection into the upper genital tract. In breastfeeding patients, it can be used after 6 weeks. So, what is the site and time of insertion? Site is the medial aspect of non-dominant arm in the groove between the biceps and triceps. It is inserted under the skin. It should be inserted within 5 days of menstrual cycle. If using combined OCPs, inserted on the day after last active pill. If using POP, progesterone only pills, on any day or month. If using injectables on the day when next injection is due. If using intrauterine devices when the previous IUD is removed. After first trimester abortion, immediate after abortion, up to 5 days it can be inserted. Or 4 weeks after the second trimester abortion and or 6 weeks after the delivery. It is a time to insert. Complications. Complications may be due to insertion. There may be slight pain, paresthesia, little bit infection, bleeding, hematoma. These are the rare complications. As it is a very small rod, and scarring will be minimum. Bruising. But more important is it requires expertise for removal. So above mentioned complications are the minimal complications. So this is not a problem for these patients. What are the side effects? Side effects are similar to those any other hormonal contraceptive devices. As it contains hormone, so it causes the endometrial atrophy. The atrophic endometrium can bleed at any time. So it will lead to irregular vaginal bleeding, mood swings as it is a progesterone, breast tenderness, acne, weight gain, ectopic pregnancy if pregnancy occurs. But chance of conception is rare in this method. What are the contraindications for its use? Ischemic heart disease, stroke developed while using it, carcinoma breast, liver tumors, acute thromboembolism, undiagnosed abnormal vaginal bleeding. Now we will discuss about the progesterone only injectable contraceptives. These are the most commonly used methods in villages because these are supplied by the government free of cost. So these methods are 99% effective and safe. These are long-acting methods, convenient to use. First injection is always given by the doctor after proper taking history. Later on, GNMs, ANMs can introduce injection. There are the two types of injection. One is DMPA. It contains depomedeoxyprogesterone acetate 150 mg microcrystalline suspension. It is given every 3 months. Second injection is norethistérone enanthate (NET-N). It is an oil-based injection. It is used every 2 months. But most commonly used injection is the DMPA. It is also called Antra. Mechanism of action: inhibition of ovulation, endometrial atrophy, thickened cervical mucus. All the contraceptive devices which contain progesterone, their mechanism of action is similar, their side effects are similar, selection of candidates are similar. Suitable candidates: women aged 18 to 45 years, breastfeeding mothers after 6 weeks of delivery, severe dysmenorrhea, fibroid uterus, antitubercular drugs, antiviral drugs, anti-epileptic drug users, women with thyroid disorders, adequately controlled hypertension and uncomplicated diabetes. The patients with all these problems can use these injections. A site and time of insertion: it is given IM. Preferred site is deltoid muscle. Otherwise, you can give injection on gluteal region or on the outer anterior aspect of thigh. DMPA is given every 12 weekly, but there is a grace period. It can be given 2 weeks earlier to the exact date or 4 weeks later. If gap is more than 4 weeks, additional contraceptive method should be used for 7 days. NET-N is given every 8 weekly. Time of insertion on day 1 to 7 of menstrual cycle. In the case of delivery, 6 weeks after delivery, if the mother is breastfeeding. And additional contraceptive should be used for 7 days if delayed, immediately or within 7 days of abortion. What are the post-injection instructions to women? Number 1, no massage or hot fomentation, as this medicine is not for the immediate release into the systemic circulation. So it is deposited in the muscles, so it is slowly released from these muscles for 3 months. Instruct to come after 90 days. Hand over the DMPA client card to her after explaining its content, because along with the injection there is a card on which date of insertion is written, other instructions are given, and when to come back. It is all written on this client card. What are the advantages of DMPA? It decreases the menstrual cramps and premenstrual symptoms. It improves anemia, reduces symptoms of endometriosis, decrease benign breast diseases and ovarian cysts, as it prevents ovulation, prevent or decrease fibroid size, reduce incidence of PID and endometrial cancer and possibly ovarian cancer, reduces sickle cell crisis in the patients who have sickle cell anemia. This drug has the minimum drug interactions. What are the complications? What are the contraindications to its use? Uncontrolled severe hypertension, uncontrolled diabetes, stroke, ischemic heart disease, thromboembolic events, migraine, unexplained vaginal bleeding, breast cancer, liver tumors, etc. So what are the disadvantages of this injection? It decreases bone marrow density over a prolonged period of time. It can lead to the irregular vaginal bleeding. On prolonged use, it leads to the amenorrhea. 50% experience after 1 year. Mood swings and depression. Weight gain about 2.2 kg within 1 year of use. Delayed return to fertility when discontinued. About it takes 10 months. Namaskar, Jai Hind.